day. Welcome to our learning session. And our topic for today would be establishing priorities. And my goal for discussing these strategies is to show you that NCLEX RN is easy if you know what to look for. For example, the nurse would prioritize care and provide treatment first for a client with letter A, head injuries, letter B, ventricular fibrillation, letter C, a penetrating abdominal wound, or letter D, a fractured femur. So if you are being asked this kind of question, you have to know which among the following is the most life-threatening. So letter A, head injuries, yes, that can lead to increased ICP or intracranial pressure, but there is no manifestation that is suggesting so. Letter B, ventricular fibrillation. Well, we know that ventricular fibrillation is the most life-threatening cardiac arrhythmia, and that is the most life-threatening. Letter C, a penetrating abdominal wound, which can lead to a hemorrhage. Letter D, a fractured femur, but it's not saying if it is an open or a closed fracture. So if you are being asked this kind of question, the best answer would be letter B, ventricular fibrillation, since this is the most ominous cardiac arrhythmia, and that is leading to death immediately, if not paid close attention. Next, which client should the nurse attend to first? Letter A, a client with hepatitis with jaundice. Letter B, a client with diverticulitis with rigid abdomen. Letter C, a client with glaucoma with blurred vision. Or letter D, a client with Meniere's disease with vertigo. So, we have to take note that any expected finding is not your priority. What do you mean by that? For example, letter A, a client with hepatitis A with jaundice, it would be expected that this client would be manifesting jaundice because of the problem of the liver. Letter B, a client with diverticulitis with rigid abdomen, that is something that is not expected because in diverticulitis, that is an inflammatory bowel disease, meaning what we are expecting for clients with diverticulitis would be alternating constipation and diarrhea. So, in the event there is a manifestation of rigid abdomen, that can indicate rupture or perforation of the bowel, or that may also mean peritonitis, which is a complication. Letter C, a client with glaucoma with blurred vision. Well, that is expected because in client with glaucoma, there is an increased intraocular pressure and there is a problem with seeing the peripheral vision or absence of peripheral vision. So blurred vision is something that is expected. And letter D, a client with Meniere's disease with vertigo. In Meniere's disease, that is a problem in your cranial nerve number 8, which is the auditory nerve. So it's expected that there are three things: hearing loss, vertigo, and tinnitus. So therefore, which client should the attend to first? Answer would be letter B, a client with diverticulitis with rigid abdomen, because that is presenting or that is a manifestation of a complication. And the rest are all expected. So, if you want to do it easily or easier, you have to do the power of elimination. Eliminate A, C, and D because all of these are expected. And this is an unexpected finding. Letter B, a client with diverticulitis with rigid abdomen. Next, functional concepts on establishing priorities based on client's data. This would be our functional concept. The age of the client is crucial in establishing priorities. What do we mean by that? When we talk about age, we have to pay close attention to the very young and the very old. Meaning, very young is a client below 1 year old, and very old is a client above 16. They are your priority for prevention of infection and dehydration. So remember, below 1 year old and above 60, those are priority for prevention of infection and dehydration because they are potentially immunocompromised. So for example, Let us apply that traditional concept. The nurse is assigned to the following four clients. Which clients should the nurse consider as most at risk to infection? So remember, when we are talking about infection and dehydration, we have to pay particular attention to the age of the client. So when we talk about age, we're talking about very young and the very old. So can you see very young and very old to the age of the client being presented on the option? So letter A 45-year-old receiving chemotherapy, that is not falling under the very old category. Letter B, a 46-year-old with a post-open cholecystectomy. Letter C, a 50-year-old diabetic. Or letter D, a 40-year-old preterm baby. So what could be our answer? You are right. The answer is letter B, a 40-year-old preterm baby. For once, that is 40-year-old, so below 1-year-old. And secondly, the client is preterm. So most likely, if the meaning is preterm, so the client is in the norm of the mind. So therefore, that is placing the client at risk to infection. Okay, moving on. Next, which of the following clients is most at risk to cancer? A, 19-year-old palmipara. B, 45-year-old pradipara. C, 60-year-old smoker. Or letter D, 50-year-old hypertensive. So remember, the most definitive or distinguishing factor, risk factor to cancer would be age, meaning to say above 55. So can you see above 55 on the category or on the options being provided? You are correct. Letter C, 6-year-old. Next, main strategy, functional concepts and establishing priorities based on clinical signs and symptoms. Take a look at this. The functional concept, the ABCD priority signs and symptoms are, we have your A, anaphylaxis, B, black airway, C, circulatory collapse, and D, drooling. So these mnemonics will be found on your NRS. That is your NRS meaning nursing or nurses reminder sheet on page 15. So if you're going to apply the ABCD priority signs and symptoms in the question, which client will the nurse attend to first? Letter A, a 65-year-old client with CVA with left body weakness. Letter B, a 70-year-old client with multiple sclerosis with diplopia. Letter C, a 50-year-old with myasthenia gravis with ptosis. And letter D, a 67-year-old with Parkinson's disease with drooling. So we can apply the power or the process of elimination. Eliminate letter A. Why? Because left body weakness is expected on client with CVA or cerebrovascular accident. Letter B, a 70-year-old with multiple sclerosis with diplopia. So we have to eliminate also. Why? Because diplopia is the initial manifestation of multiple sclerosis, wherein there is a demyelination of the myelin sheath. And that is something that is expected. That is the initial manifestation of multiple sclerosis. Let me see. A 50-year-old with myasthenia gravis with ptosis, we have to eliminate that once again because in myasthenia gravis there is an expected descending paralysis. So meaning to say, the paralysis would be initially manifested in the eye. So when you talk about ptosis, that is just drooping of the eyelid, and that is something that is expected. So by the process of elimination, you are eliminating A, B, and C. That in that portion, that will leave you to answer letter D. Why? 67-year-old with Parkinson's disease with drooling. As we have said, your priority would be A, B, C, D. Again, what are those A, B, C, D, A? Anaphylaxis. B, black airway. C, circulatory collapse. And D, drooling. And that drooling can lead to aspiration. And we are not expecting drooling from client with Parkinson's disease. We might experience bradykinesia, we might experience shuffling gait, but not drooling. As a matter of fact, when you talk about the drooling on a client or when you found drooling on a client with Parkinson's disease, that is actually a manifestation of a Parkinsonian crisis. And remember, whenever you hear the word crisis, that will always be your priority because that is a life-threatening condition. So therefore, what is your answer? Letter D, 67-year-old with Parkinson's disease with Drury. Another question. Which client will the nurse attend to first? Letter A, a 45-year-old with anemia with pallor. Letter B, 50-year-old with blood pressure of 72/46. Letter C, 60-year-old with COPD with respiratory rate of 22. Or letter D, a 67-year-old with elevated registered loss due to insect bite. So, if we're going to apply what we have, what was in our concept a while ago, anything that is expected is not your priority. So letter A, a 45-year-old with anemia with pallor, that is something that is expected. So it is expected that if you have anemia, you lack iron, you lack folic acid, you lack certain vitamins, that can lead to pallor or absence of color, being pale. Letter B, a 50-year-old with a blood pressure of 72/46. So, is that ringing a bell? Well, 72/46 is a manifestation now or suggesting that there is a circulatory collapse because of a very low BP, or that is a severe hypotension leading to shock. So is that falling under ABCD? Yes, anaphylaxis, black airway, circulatory collapse, and bleeding. So letter B might be an answer. Letter C, a 60-year-old with COPD with respiratory rate of 22. Well, the client is 60-year-old with chronic obstructive pulmonary disease. Remember this, when you are being caught between acute and chronic, you have to prioritize the acute because acute will always be unstable. So since that is chronic, we can eliminate letter C. And letter D, a 67-year-old with elevated red skin rash due to insect bite. Well, whenever you have insect bite, it is expected that you might present an elevation or a skin rash. So therefore, what would be our answer? You're right. Letter D, 50-year-old with blood pressure of 72/46 because that is an indication of circulatory collapse. It is so easy, isn't it? Okay, let's move further. Drooling, another functional concept. Drooling increases the risk for aspiration. So therefore, a client with Parkinson's disease should be assessed for which complication? Letter A, coliform movement. Letter B, aspiration. Letter C, thrombophlebitis. Or letter D, relation. As we have said, drooling can lead to aspiration. So there are two words that we need to consider whenever we're talking about this concept. If you didn't see drooling, the word bleeding, you have to take into consideration the word aspiration. So therefore, letter B is the answer. Suppose we alter or we rectify or we change the disease. Let's change the Parkinson's disease to client with multiple sclerosis. What is the highest priority nursing diagnosis for client with multiple sclerosis? So A, is aspiration, B, pain, C, hyperthermia, or D, odor mutation. So all we have to do is to apply our functional concept. So what is your answer? All right, letter A is for aspiration. Another thing, which symptom needs to be reported if seen in the client with amyotrophic lateral sclerosis? Is it A, odynophagia, B, pain, C, muscle weakness, or D, drooling? So if you just bear that in mind, A, B, C, D, there would be no problem in answering this kind of questions. Okay, so what's your answer? Drooling. Next, another strategy, functional concepts on establishing priorities based on client's condition. The nurse is assigned to the following four clients. Which client should the nurse assess first? Letter A, a 50-year-old receiving chemotherapy with a temperature of 101 degrees Fahrenheit. Letter B, A 46-year-old 2 days post-operative with an open cholecystectomy. Then we say, a 50-year-old diagnosed diabetic complaining of blurred vision. Or every day, a 40-year-old ready for discharge to a rehab center. So in here, you can do the process of elimination. Let us eliminate letter D, a 40-year-old ready for discharge to a rehab center, because you have the keyword ready for discharge. So when the client is ready for discharge, we need to say the client is now stable. So that is not your priority. Now, if you are going to choose among options A, B, and C, always remember this. A client with an ongoing procedure should always be your priority. So let us check. Can you find among the options anybody who is undergoing an ongoing procedure? Okay. Another thing. Client who is presenting an acute complication will always be your priority. So among A, B, and C, which is presenting an acute complication? You are right. So your answer is letter A. A 50-year-old receiving chemotherapy with a temperature of 101 degree Fahrenheit. Why? The client is undergoing an ongoing procedure and the client is manifesting an acute complication. As compared to your letter B, 46-year-old 2 days post-operative with an open cholecystectomy that is not presenting any complication. The letter C, a 50-year-old diagnosed diabetic complaining of blurred vision. Well, diabetic itself is a chronic condition. Okay, so between acute and chronic, you have to prioritize the acute. So that will leave us the answer letter A. Moving on. Focus on the client's condition when the question is about who should the nurse admit first? Who should the nurse discharge first? Who should the nurse test first? Who should the nurse evaluate first? So remember, prioritize unstable clients. If unstable client is not in the option, you can prioritize newly diagnosed clients. But remember, if you are encountering questions between unstable and newly diagnosed, prioritize the unstable first among anybody else or over anybody else. So unstable, if you didn't see unstable, then you can answer newly diagnosed because these are the acute clients and acute are unstable. If you didn't see unstable, then you can answer newly diagnosed client. But remember, you have to discharge the stable client first. So for admission, assessment, and evaluation, prioritize the unstable and the diagnosed. But who are you going to discharge first? You have to discharge the stable clients first. So you can discharge the chronic clients, but you have to admit the newly diagnosed or the unstable clients. Next. So if you're going to apply that, which client should the nurse evaluate first? Letter A, a 45-year-old man who is diagnosed with diabetes. Letter B, 68-year-old man with COPD. Letter C, 51-year-old woman with chronic gout. Or letter D, a 65-year-old woman on her second year of rehabilitation after cerebral vascular accident. So, we have to move the power or the process of elimination. So remove letter D because the woman is on her second year of rehab, so that is something that is stable. Letter C, 51-year-old woman with chronic gout, and letter B, 68-year-old woman with COPD. Both of them, they have the word chronic. So basically, where will that lead you? To answer letter A, 45-year-old man newly diagnosed with diabetes. Correct. So, another functional concept, acute complications are considered as a priority. The nurse assigned to the following four clients. Which client should the nurse assess first? A. 40-year-old post-trans urethral resection of prostate with impotence. B. A 46-year-old 2 days post-TURP with fever, transurethral resection of prostate. Letter C. A 50-year-old diagnosed with BPH, complaining of urinary dribbling. Or letter D. A 40-year-old with BPH, complaining of sleep disturbance due to nocturia. Okay. In this question, we can eliminate C and D. So why can we eliminate C and D? Because on clients with benign prostatic hypertrophy or benign prostatic hyperplasia, it is expected that the client is presenting urinary bleeding, incomplete bladder emptying. There might be dysuria, which can interfere with the clients. So there might be nocturia. So letter C and letter D are both expected. Meaning to say that will leave us to choose between letter A and letter B. Letter A, 40-year-old post-TURP, and letter B, 40-year-old post-TURP. So both of them underwent TURP, but letter A is presenting impotence, letter B is presenting fever. So what did we say? Client with acute complication will always be the priority. So between impotence and fever, which is an acute complication? You are right. The answer is letter B. Letter A is a complication, but that is chronic. So the answer is letter B, TURP with fever. Okay, so focus on the symptoms when the question is about the complications. Prioritize acute complications over chronic complications. And prioritize signs and symptoms related to ABC. So airway, breathing, and circulation. So functional concept for clients in a medical unit, acute conditions or complications should be seen first by the nurse because they are what? You are unstable. So if we're going to apply that, nurse is assigned to the following four clients. Which client should the nurse assess first? Letter A, 56-year-old receiving brachytherapy with a temperature of 104 degrees Fahrenheit. B, a 42-year-old with pancreatitis complaining of stomach upset. C, a 47-year-old diabetic complaining of blood vision. Or letter D, a 35-year-old COPD client who is ready for discharge. It's getting easier, isn't it? So let us do the process of elimination. Let us now eliminate D. Why? Because the client is what? Chronic and ready for discharge. The client is stable. Also, eliminate letter C. Why? Because diabetic itself is a chronic condition. Blood vision might be a chronic complication. Letter B, a 40-year-old with pancreatitis complaining of stomach upset, but it's expected that if a client is having pancreatitis, the client is having autodigestion of the pancreas, so there is an expected pain accompanying the complication. So, what is the answer? You are right. Letter A, 56-year-old receiving brachytherapy with temperature of 104 degrees Fahrenheit. Why? Because the client is receiving or is undergoing an ongoing procedure and there is an acute complication, which is the another functional concept. Clients with uncontrolled hemorrhage need to be treated immediately. Why? Because this can lead to shock. And shock is always your priority because that is very life-threatening condition. So, client with uncontrolled hemorrhage that can lead to what? Circulatory collapse, which can lead to shock. So, therefore, these clients, they are needed to be treated immediately. Let's apply that on our question. Which of the following conditions, if exhibited by clients in the ER, needs to be treated immediately with fluid infusion? So you have the clue, there is the word fluid infusion. So basically, we are looking for a manifestation of a circulatory collapse or shock. So remember this, whenever you are looking for shock, always take into consideration the vital signs of the client. It should be hypotension, tachycardia, tachypnea with narrowed pulse pressure. That is why we always say the word hypotachy with narrowed pulse pressure. What do you mean by hypotachy? Hypotension, tachycardia, and tachypnea. So we're going to include that into our concept. So did you see hypotachy? You are right. So the answer would be tachycardia and hypotension after thyroidectomy. Letter A, that is something that is expected. Letter C, digoxin, that is a cardioglycoside, which can decrease the heart rate of the client. So bradycardia is something that is expected after taking digoxin. Letter D, muscle spasm after neck surgery. Well, that can lead to laryngeal spasm, but that is not what is the question is asking you. The question is asking about fluid. So you are looking for shock. You are not looking for airway obstruction. So if you are looking for airway obstruction, you might answer the muscle spasm because that can lead to laryngeal spasm. But if you are looking for the question which will need fluid infusion, you are looking for shock. You are looking for cardiac or circulatory collapse, which is manifested by hypotachy. So the answer is okay. Another functional concept. Clients with open fractures are considered as priority one because open fractures, specifically if they are occurring in the long bone, can lead to fat embolism, which can consequently lead to pulmonary embolism, and that is life-threatening condition. So, which of the following variants needs to be seen first by nurse after a motor vehicular accident? Okay. So on this particular condition, there is another technique that we might use. When you see two opposing ideas on the question, most of the time, the answer is in those two opposing ideas. So can you see two opposing ideas? Option, right, that you see, at in favor with open fracture of the left femur, and letter D, an elderly client with closed fracture of the right arm. So eliminate A and B. So we are to focus between C and D. So what did we say? Client with open fracture, specifically of the long bone, would be your priority because that can lead to embolism leading to pulmonary embolism. So what is your answer? There's major open fracture of the left. Another functional concept, a post-client with surgical incision near the diaphragm should be seen first by the nurse. So why? Because remember, if there was a surgical incision in the diaphragm, that can impair the deep breathing or that can get in the way of the proper deep breathing exercises and coughing of that man. So therefore, there is a sign to the following for clients in the surgical kit, which client should the nurse attend to first? Letter A, a 40-year-old client, 2 hours post-bladder surgery. B, 40-year-old, 2 hours post-gastric surgery. C, a 47-year-old, 2 hours post-cataract surgery. Or letter D, a 35-year-old, 2 hours post-appendectomy. Okay? So all you have to do is look for an incision near the diaphragm. Okay? So remove letter A, bladder surgery. Also remove letter C, cataract surgery. So between gastric surgery and appendectomy, which do you think is near the diaphragm? You are right. So your answer would be that 4-year-old 2 hours post-cascade exposure. So again, a sign or symptom that indicates a complication is a nursing priority. So we have to apply. Which of the following clients needs to be seen first by the nurse? Letter A, client with ulcerative colitis with bloody diarrhea. Letter B, client with cholecystitis with right upper abdominal pain. Letter C, client with otitis media with sudden relief of pain. Or letter D, a client with appendicitis with lower abdominal pain. Okay, so we do the power or the process of elimination. You have to eliminate letter A. Why? A client with ulcerative colitis with bloody diarrhea, that is something that is expected. As a matter of fact, since that is an inflammatory bowel disorder, where bloody diarrhea can be up to 10 or more than 10 episodes per day. The recent findings, okay, so we have to apply that. Which of the following clients needs to be seen first by nurse? There are 8 clients with ulcerative colitis with bloody diarrhea. Letter B, client with cholecystitis with right upper abdominal pain. Letter C, a client with otitis media with sudden relief of pain. Or letter D, a client with appendicitis with lower abdominal pain. Okay, let us do the process of elimination. Let us eliminate letter A, a client with ulcerative colitis with bloody diarrhea. Why it is expected. Since ulcerative colitis is an inflammatory bowel condition, you are expecting the client to present bloody diarrhea. As a matter of fact, it would fall between 5 to 25 episodes per day. Letter B, a client with cholecystitis with right upper abdominal pain. So remember, if your client, anything with itis, anything with inflammation, no? Okay. Which of the following clients needs to be seen first by the nurse? Is it A, a client with ulcerative colitis with bloody diarrhea? Letter B, a client with cholecystitis with right upper abdominal pain. Letter C, a client with otitis media with sudden relief of pain. Letter D, a client with appendicitis with lower abdominal pain. So, we have to do the process of elimination. You have to eliminate letter A. Why? Client with ulcerative colitis with bloody diarrhea. That is something that is expected. As a matter of fact, the bloody diarrhea may take up to more than 10 or usually 5 to 25 episodes per day because of that inflammation in the bowel. Letter B, a client with cholecystitis with right upper abdominal pain. Whenever there is itis, there is an inflammation. So expected that the client is experiencing right upper abdominal pain. And that is having the same nationality as for letter D, a client with appendicitis with lower abdominal pain. That is expected because the appendix is situated on the right lower quadrant. So that is something that is expected. So that is leading us to answer letter C, a client with otitis media with sudden relief of pain. Why? Remember, not all relief of pain is presenting a passive sign. There are relief of pain or relief of conditions manifesting they are being relieved from pain but is presenting a negative condition or acute complication. For example, a client with otitis media with sudden relief of pain may mean eardrum perforation. Another example, client with appendicitis with sudden relief of pain may mean rupture of the appendix, which can lead to a life-threatening complication.
Thank you very much for watching and see you all again next time. And please don't forget to subscribe. Bye!
This is my